Hello and welcome to another episode of the program Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Scheme to update you on the strides it is making towards attaining universal health coverage. Health insurance is a game of numbers. The higher the number of participants or enrollees, the larger the pool of funds and the more efficient the health cover. What are the numbers looking like now for the NHIS? How is it funded? What is the scheme doing to increase the numbers and the funds, thereby increasing access? These and more issues is what we will be discussing today. I am Aisha Muhammad Ahmed, your regular anchor. Don't go away.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS coming up in our news diary. Keep watching.
The Minister of State for Health, Dr. Olorunimbe Mamora, has directed the National Health Insurance Scheme to support the Borno State Contributory Healthcare Management Agency. He gave the directive at a ceremony held to launch the Borno State Basic Healthcare Provision Fund and disbursement of 418 million naira to 79 primary healthcare centers in the state. The launch was held at the multipurpose hall of the Government House in Maiduguri with the participation of Governor Umara Zulum, the Minister of State for Health, who was represented, the National President of the Nigerian Medical Association (NMA), the Executive Secretary of the National Health Insurance Scheme, and other healthcare stakeholders. The minister, who was represented by the Chief Medical Director of the University of Maiduguri Teaching Hospital, Professor Ahmed Ahijo, also commended Governor Umara Zulum of Borno State for his strides in developing the primary, secondary and tertiary healthcare in Borno State. This, he said, is evident in the ongoing construction of the Borno State University Teaching Hospital and the establishment of a medical college, as well as the construction of numerous primary healthcare centers. Others include upgrading and modernizing existing hospitals and equipping them with medical workers, diagnosing equipment and drugs. The Executive Secretary of the NHIS, Professor Muhammad Nasser Sambo, aligned with the minister in recognizing the plans to develop Borno State healthcare sector by the governor. He also promised the support of the NHIS to the Borno State Contributory Healthcare Management Agency and called for the judicious use of funds for the provision of healthcare to the vulnerable.
Welcome back. Funding is a major challenge in healthcare provision. Where resources are sufficient, the scope of provision can be almost limitless. Closely related to these is the management of these funds to achieve the objective of healthcare provision. How are funds pooled and managed by the NHIS, and what plans are being explored to increase the pool of resources so that the NHIS can better cover Nigerians? These and more in our next segment, issues around the NHIS.
Easy access to quality healthcare for all. NHIS.
Sicknesses and illnesses are a part of human life. Every now and then, people fall sick and need a doctor to treat them or their loved ones. This can easily become burdensome, especially on the finances of individuals and families.
Sicknesses and illnesses do not announce themselves. Even when you have a premonition, something may happen. You may not know what the cost would be like. And nobody sets aside money for sicknesses. So rather than people just fall ill and then go to the hospital, bear enormous costs, and that may lead to their having to sell properties and all that, we encourage them to get a health insurance cover.
To provide that insurance cover for its citizens, the federal government in 2005 established the National Health Insurance Scheme to give Nigerians easy access to healthcare and free them from the burden of having to pay for healthcare.
One of the major concerns of the healthcare system globally is how to mobilize resources, how to pool resources, and how to allocate resources to ensure effective delivery of healthcare delivery system. So NHIS is an organ of government that is created to do that. NHIS, if fully implemented, it has the ability to protect family and individuals and community from hardship of settling medical bills.
The first set of persons to be covered were civil servants and those in the service of the federal government, including all military and uniformed personnel. As such, the formal sector social health insurance program, which gives health cover to a principal, the spouse and 4 biological children under the age of 18. How is this program funded and managed?
The NHIS is funded by funds from contributors. That's the federal government staff whose contributions are remitted to the scheme by the federal government. We also have self-funding agencies who also remit their funds to the scheme on behalf of their staff. We also have organizations in the organized private sector. They also contribute on behalf of their staff. And we have individual contributors in our gift ship program, individual, family and group contributors. And sometimes we have something that the federal government sometimes puts aside for vulnerables in community-based social health insurance programs. The contribution management department basically manages contributions received from on behalf of the contributors of the scheme from the federal government, self-funding agencies, private sector agencies, and also in the various NHIS programs like the group, individual and family social health insurance program. We manage the funds, make sure that they are also dispersed appropriately and on time to the healthcare facilities through the health maintenance organizations. We also ensure that we reconcile those funds that are dispersed to make sure that, the funds are also being used for what they're meant to be used for, and any funds that have not been dispersed to hospitals are refunded back to the scheme.
As it were, less than 10 million Nigerians are covered under the formal sector social insurance program. Quite a number of Nigerians are outside this spectrum, and there is need for more funding.
Considering the poverty level of Nigeria, there are so many people who cannot pay, and if we must achieve equity in health insurance and coverage, it means that somebody must pay for them. So with more funds, we can guarantee that more people can be covered, and greater funding also ensures we can do some cross-subsidy among the different groups that are contributing or paying their premium. So, and it makes the system more robust, more stable, and there's less risk of failure in the system.
As it is, the NHIS is looking at how available funds can be better managed, since research has shown that contributions can be further maximized to provide care for the vulnerable.
One of the things that we have clamored for is for the federal government to allow us to invest our funds that are not being put to use at this moment. Because if we are able to do that, then as every other health insurance process, just like the pensions as well, if we are able to invest our funds, then there will be much more than we have now, so that it actually can go around and we can actually plow that the return on investment into either expanding the benefit package for those who are already on board, or actually using some part of that to fund vulnerables who cannot actually contribute for themselves.
Another major step that will help the scheme deliver on its mandate is innovative financing. It is a key component in resource mobilization used to fill the existing financial gaps. As it is, there are various financing streams that the NHIS is exploring.
Health is not free. Somebody has to pay for somebody. Okay. So the innovative financing is just exploring the sources of funds outside the traditional sources. For instance, he has developed a program called Giveship Group, Individual, Family, Social Health Insurance Program, which means as an individual, you can key in, as a family, you can key in, as a group, you can key in. You know, if you travel to a village, people at home will bother you with the issue of health and all that. That will give more money, this person is sick, the other person is sick. But you can pay for them here. Say, okay, I am paying for so number of persons. They register them so that anytime somebody is sick, he does not have to pay from the pocket before the person is attended to, is prepaid. Good. And also, we have partnered with NYC for the coverage of NYC. It's the technical working group is working on the retiree program. That's also innovative financing. And sin tax, maybe taxing tobacco and all that. Also, maybe a philanthropist can say, okay, let me pay in this amount of money. He can give us the list of people to be covered by such amount, or he can ask us to select whichever option. Good. People in the diaspora, they have relations in Nigeria here. So if somebody is sick, he doesn't need to come home. All he needs to do is to key into the program.
The NHIS Act is also being amended to make provision for telecom tax as another means of financing health insurance in Nigeria.
If you think about it, in Nigeria, with a population of over 200 million, we also have over 200 million lines, and you and I know that a lot of us have more than one line. And so if we're able to tax ourselves maybe 1 kobo per second on each calls that we make, then that will actually make a lot of difference to what we have. And the fact that everybody is paying for a service that they choose to receive, people will be willing to make that sacrifice, because, for example, we all have drop calls, and I don't think we actually get that money back from our telco. So if that money can actually be used, you know, a portion of what we use to make phone calls to be pooled towards health insurance coverage, particularly for the vulnerables, I think it will be laudable, and it will make a difference in the funding for health insurance, and we'll be able to cover much more. Our attainment of universal health coverage will be seamless and may actually turn up earlier than the 2030 time frame that we have given ourselves.
Stakeholders also have a role to play, especially in the march towards attainment of universal health coverage.
Well, stakeholders, particularly the state governments, must be intentional in ensuring that they, first of all, cover their formal sector population in their various states, and also be intentional and deliberate about setting aside funds to cover their vulnerable populations.
Prudent management of resources is a major area of concern for most Nigerians. On this score, the current management of the NHIS has put in place an agenda that includes financial accountability amongst other initiatives, which is indeed yielding results.
Before his time, there were some funds trapped, some of the organization's funds trapped in some banks, which EFCC is helping us in the recovery. They have recovered some funds, but they didn't release it before it's coming. When the organization paid a courtesy visit on the chairman and the management of EFCC, after highlighting our operations, how we will operate, the chairman EFCC told him that yes, they have recovered some funds because they didn't see transparency and accountability in the system. That's why they had not been able to to remit the funds. But after the explanation and all the things he has put in place, recall he has concluded the development of strategic 10-year strategic plan, which tells you where the organization is going in the next 10 years, which means they have a vision and a mission, and they are focused. Yeah. We have also, and the EFCC have remitted the recoveries they have made on our behalf. That's as a result of the transparency and the accountability.
Welcome back from that break. Easy access to healthcare continues with our stakeholders segment, and tonight we bring you our chat with yet another HMO involved in the implementation of the scheme. He is Dr. Ahmed Yakase, the MD of Police HMO. The Police HMO is the largest HMO in Nigeria. It caters for both personnel of the Nigeria Police Force and their relations, as well as persons outside its core mandates. It is involved in both formal and the informal programs, even the gift ship program. Police HMO has been in partnership with NHIS since 2013. Dr. Yakase describes the scheme as a lifesaver.
It's a lifesaver. It has given a lifeline to a lot of workers, things that, ordinarily the individual cannot afford now, they can afford through the NHIS scheme. And it's just a token of their salary that is being deducted. And for that, it had, prevented a lot of families from having financial catastrophe. So NHIS had really, I would say that they have recorded success, and I would also say that in terms of giving some quality, care and management, I would say that they have come in a long way to salvage, the common man, especially the civil servants.
Speaking on the roles of the HMO, Dr. Yakase stressed on the relationship between the NHIS and the HMO as it relates to service delivery.
NHIS has, in its own guideline, has given some level of functions on the HMOs to carry out. So because monies are being appropriated to are being given to the HCPs, so there is also the need for it to carry out like an oversight function on those HCPs. And this is with the sole purpose of ensuring quality services being delivered to the enrollees. things like the monitoring and evaluation, which I had earlier mentioned, things like quality assurance. And the data so generated also will help a long way in healthcare planning and budgeting for both the HMOs and also the NHIS and even the Federal Ministry of Health as a whole.
For a big HMO, challenges are inevitable. The MD speaks about them.
Very challenging, because when I came in, things were not actually what they should be. But by the grace of God, now the company has stabilized, and we've improved significantly. Even though some of the challenges, you know, when you pass one hurdle, you get to reach another. With the abrupt expansion of our enrollee base also came other problems which we are trying to surmount.
In giving an assessment of the healthcare system in Nigeria, Dr. Yakase says successes have been recorded, but there's room for improvement, especially at the primary level of care.
Divided into the primary, secondary, and tertiary levels. And each of these levels is supposed to carry out particular functions and roles which are complementary to each other, failure of which will, you know, impact negatively on the system as a whole. So we can say that there are positives that are recorded, and there are also on the flip side the negatives. The positives are mainly at the top level, that is at the tertiary level, where you have some or most of our tertiary level care, you know, conducting and carrying out high-tech diagnosis and complicated or complex surgeries. But when you look at the other side, you find out that at the grassroots level, where the common man is at the receiving end, so to say, you realize that such things are either still rudimentary or they are outrightly absent. And so therefore, the 3 A's of accessibility, availability, and affordability are not there. So by and large, if you are going to look at it holistically, you say, okay, that we've recorded some successes, especially at that topmost level, and some minuses, of course, at the grassroots level.
Dr. Yakase suggests possible steps that can help the scheme attain universal health coverage amongst its objectives. He also commends the management of NHIS.
But for the current NHIS boss, I think he is on the right track, and he has done quite a number of, should I say, interventions in the NHIS, and the most important is what he termed as the rebranding of the NHIS. And under it, there are so many subheadings, and I think he is taking them one at a time. And the ultimate is that there would be huge improvement in what we are seeing. Aside from that, the NHIS that has been, you know, that has been assented by the President of the Federal Republic of Nigeria also will go a long way towards the attainment of the UHC.
Dr. Ahmad Yakase, MD, Police HMO there, speaking on NHIS and Police HMO. Up next, your questions answered. Don't go away.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: where can one register for the NHIS?
We have the NHIS state offices. One can go there and register with the NHIS for the various programs. We equally have what we call the contact center in Abuja, where anybody can go in and do enrollment.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on the program today. Join us again, same time and on this same station for another interesting episode as we continue to bring you more stories of happenings around the NHIS. Remember, COVID-19 is real. Take every health precaution and get vaccinated. See you next week.